Hi, I'm Kathy Goldstein, and I'm coming from Jacksonville, Florida, where I have a practice, and I'm traditionally trained in acupuncture. I'm an acupuncture physician, and this is Dr. Rhodes, Lisa, and I'll let her introduce herself.
Thank you. So I'm located in Pennsylvania, near Philadelphia, in the suburbs of Philadelphia, and I'm a functional medicine practitioner, using multiple modalities to address the body in a way that's going to have the best effect for any particular person.
Yeah, it's sometimes it's hard to almost explain what we do in a general way, because we're doing energy medicine and functional medicine, and have a toolbox, and you use your toolbox in particular ways, but it's always an interesting thing to wrap up into a couple of sentences.
Right, yeah. Mm-hmm.
So we were talking about a lot of times when a new patient comes to us, and especially if they're not familiar with holistic medicine or functional medicine, meaning medicine that gives your body function, right?
Mm-hmm.
And so a lot of times where we're starting is that people come with a symptom, and that's normal because it's generally the symptoms that interfere with their life that is what motivates them to actually come to us. So how do you take a person from seeing that their symptom is only a symptom of potentially a much larger or different root?
So I'm going to use an analogy, surprise.
Go ahead. I like that.
So if you think about an iceberg, and as an iceberg grows, it starts, or it gets larger, it's under the water, and it gets larger and larger and larger. And at some point it peaks, it breaks the surface of the water, and we can see the iceberg. So if you think of the iceberg as symptoms, but everything underneath the water is kind of what happened for that symptom to occur. So the symptom is just kind of the body yelling out and saying, hey, we need to do something here, pay attention. But the below the iceberg is all that internal function that has, or dysfunction that has occurred, that ultimately ends up as symptoms.
Yeah, so actually I really like that analogy, because everybody's actually familiar. Well, it's only the tip of the iceberg.
Right? Yes, right.
What you say. And I think it's a great analogy because, what you're really talking about is that symptoms are not the first sign of dysfunction. They're generally the last sign of dysfunction, which brings us to almost like what will end up to be the full circle of this conversation, which is that when your symptoms go away, does that mean your body is functioning?
Right. No, not exactly.
Not exactly. So I think our conversation today is, symptoms work versus function.
Yes.
So that's a great analogy in explaining how that works, as far as like you're just seeing the symptoms. But, one of the things that we like to say is that, if you have a rock in your shoe and you take the rock out, does the pain go away? Right? Well, the pain might not go away right away because your body has to heal. And then once it heals on the surface, could have caused other problems, like you were limping because the rock was in your shoe. Now, your opposite hip hurts, or your low back hurts. So that's the repercussions of the rock in the shoe, inside the shoe.
Yeah, it's kind of like the domino effect. So, so what happens is our body goes through compensation. So one area of the body kind of gets thrown off balance, dysregulated. Another area of the body is going to say, okay, I better take care of that because that could cause some real problems if I just let it keep going like that. But pretty much that area that's compensated, that's going to get thrown out of balance, start dysfunctioning, and another area is going to compensate, and that'll just keep happening, so that there's all this compensation that's going on until you start decompensating. Take the rock out of the shoe is one form of kind of the top layer of decompensation. You get to the next layer of decompensation, that then you have to deal with that layer. until you get to that very first area that was out of balance.
Right. So that kind of brings up a couple of things for me. One is that right now the analogies that we're using kind of the analogies that are tangible because they're physical, but on a biochemical level, our glands work a lot like that, like the adrenal glands versus the thyroid glands, which versus a pituitary gland, where one of them will try to compensate for the other without you even being aware of it. Like sometimes we're aware if we're limping on our left leg that our right hip might have an issue, or our right knee. So it becomes a little bit more tangible. But what's harder to have tangible is that more internal function.
Right. And we don't know that until we get sick.
Right.
And that's the symptoms.
That's exactly right. So in our office, what I tend to say as far as that unlayering is that we're going to peel the onion, right? We're going to start with what your body can handle, which is just what's yelling at us the loudest, right? We're not going to go and rip the core out, and try to go to the center of that when your body has its own way of layering. So it's kind of the gentle way. Like I've never really been a fan of the concept of what's it called? the Herx, which is
the healing crisis.
Right. A lot of people will talk about a healing crisis, and I see you feel the same way. I feel like if someone has a healing crisis, I was too aggressive. I wasn't listening to the body, something like that. So and who wants a healing crisis, right? Nobody wants to feel worse before they feel better. And a lot of doctors will say, well, you're going to feel worse before you feel better, especially if you're talking about, someone who might do functional medicine, but their training is limited, then they aren't really looking at the body as a whole.
Yeah. And when somebody goes into a healing crisis, it can be really hard to pull them out of it. They can be sick for a long time, and you certainly don't want that. So better to be gentle and get to the end point. You're still going to get to the end point. You're just going to do it so that person doesn't feel, any adverse effects, and frankly, if you're more gentle, I think that you make better progress, because when someone is sick, they don't do the things they need to do for themselves.
That's a really good point. That's I just realized that was not be now in the middle of my head. I think that's a really good point, because I know when I have patients in my office who feel really bad, the first thing they want to know is, when am I going to feel better?
Yeah.
So good point. So let's talk about symptom versus treatment.
Yeah. So and talking more about kind of functional and on a systemic level, as opposed to saying, well, you have this symptom, and we were talking earlier, and I talked about allergic type symptoms where you have congestion, maybe you have coughing, sneezing, whatever. And you automatically think that, it's just an allergy to something. And maybe it was the allergen that was like the straw to break the camel's back, so to speak. Again, we're talking about the iceberg. But there's some kind of functional systemic dysregulation that was going on first. And as you were talking about with the glands, there's all kinds of interactions with some parts of the body more than others, but certainly all parts of the body. And so if you just look at the symptoms, if somebody were to come to me and say, I have allergies, and I say, okay, we're going to look at this as allergies, and that's the therapy we're going to use, and it's not allergies, that person is not going to get better, because you're not looking at the body as a whole and how it functionally it's integrated, and one part affects the other. So, you really have to look beyond the obvious sometimes, and look at your body as this well-oiled machine.
Right.
That when one cog gets thrown out of place, another cog gets affected, and have more of that perspective than symptom issue.
Right. Yeah. So when a person first comes into our office, we try to unlayer that from the beginning so
Mhm.
that we can, because the body will let us know what its priority is. So, I feel like our job is to listen to the body. And,
Sure.
sometimes the symptoms are speaking the loudest to the patient, but for us, when we're on layering, there's other things that speak louder.
Mhm.
So, for example, in our intake, one of the things that we are testing is on a neuroemotional level, whether they're okay being healthy. And
Mhm.
if they're not, then it almost doesn't make a difference what you do because they've already decided in their head. And so that could be the patient that has been to 10 different doctors and nobody is helping them. And there could be obviously other reasons why, especially because everybody's toolbox is a little bit different. Your
Right.
toolbox is pretty deep, so you've got a lot of different things. If someone's come to you and said, well, I've done this and I've done this and I've done this, and maybe they've done a lot of holistic things, sometimes those are great patients because they're just missing a straw. So
Right.
what do you do to unlayer?
So I do an evaluation to identify all the causative factors.
Hmm.
Um, and then once we can have a picture of all the causative factors, then also listening to the body, which factors kind of have to be addressed for other factors to fall into place.
Good point. Good point.
It may not even be, something that the patient has even considered that that needs help. But um, but unless you do that, other areas are not going to fall into place because it's again using the domino effect. If you take the wrong domino out, only half of them are going to fall down, the other half.
Right, right, right. That,
And go ahead.
no, I was going to say that's actually a really an excellent point is in that part about listening to the body that we're actually determining, is there something you need before you'd be able to even have this treatment effectively, because there's no sense in doing something that's going to be ineffective if you're not managing the underlying, for example, that they would be wasting their time and money.
Right, exactly. And you talked about, for instance, a neuroemotional component being that thing that's blocking movement forward in any other way.
Right.
Sometimes it's acupuncture. Sometimes there's meridian blocks or imbalances that until you address that, anything else you're going to do is not going to get, the whole body is not going to get the message because there's a block or an imbalance somewhere.
Right, 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 right. So gently unlayering, managing the body as it needs to be unlayered, and constantly checking in. I find that if we do that, symptoms just get knocked off. Much easier. And a lot of times, if we're unlayering like that, the symptom they came in with will go away and not even realize that it was completely unrelated to what they thought it was.
That's exactly right. And not only that, but there's the bonus of what I hear a lot is, I didn't really even think of this as a symptom, but now that it's gone and we weren't even focused on it, it's because the body works as a whole. And when you create appropriate regulation in one area of the body, any regulation that's affected is going to come into balance as well.
Yes, I totally see that too. Like, I sleep better, I have more energy. These aren't necessarily things that they came in with as a primary issue because they've acclimated to it,
Right.
in just those everyday things, and I've actually had people, hey, I didn't mention to you that I have herpes or get cold sores, but I haven't had any for 3 months. It's like, oh, that's great, but that would have been good to know. Right?
Yes, that's true.
Yeah.
Yeah.
So now that we've kind of talked about symptom versus underlying and treating the body as a whole, once we start treating people, one of the things that I know that maybe I did not do a good job in talking to people about how holistic medicine works is that if they say to me, well, my symptoms are gone, so I guess I'm done. I was like, well, wait a second, I must have missed explaining, on
How
how
the body works.
right.
Yes.
Right, which we really try to do, because like you're saying, on that iceberg, that shows up last. That's been building and building and building until it, blows up onto the surface, especially autoimmune. Autoimmune is classic for a lot of layers and different things that have been happening behind the scenes for some time.
Yes, absolutely. And even after the iceberg's gone, we don't live in a static environment. It's dynamic. It's like the example you used once before. You don't get your teeth cleaned by the dentist and say, okay, I'm done, because you're going to eat. You're going to do things that get your teeth dirty again. It's the same way with life. You're going to constantly be exposed to things that have the potential of throwing your body off balance.
Right.
It's a lot cheaper to stay healthy than it is to get sick and try to get healthy.
And so much more of your life is gained by staying healthy, because I think that, one of the things that we actually ask people in the office when they first start is, if this symptom went away, what would you do differently than what you're doing right now? And that's just based on the symptom. And it might be, well, I'd be able to pick up my kids or my grandkids, or I feel like going for a bike ride when I get home from work, or, instead of just sitting on the couch and watching TV, because that's all I feel like doing. And I fall asleep on the couch at, 8:30. So, sometimes you have to really coax it, because we think that that's normal too, like what we think is normal. And what's normal is not needing a nap, not waking up with energy. And this is just on the energy level, right? Waking up with energy, not needing a nap after lunch, and not falling asleep on the couch at 8:30.
Right. Yes. And I like that. That's a really good idea because that's really helps that person to see what's going on in their life and to have a goal. To have something that they can look forward to being able to do.
Right. So my goal, my goal has always been with patients is to get to preventative care. I want them through their treatments as best and fast as we can, because my favorite thing to work with is preventative care. Because if you can come into me and saying, hey, I don't really have any symptoms, I'm like, great, let's unpeel a layer. Let's check your brain function. Let's just check your blood sugar. Let's check your adrenals. Let's see if there's been any stress that we need to address, and that's fun. It's a whole lot more fun than, coming in and going, oh, I've had all these symptoms, and it's like, now you're just kind of chasing the tail on just trying to get back to feeling good.
Right. Yeah, I definitely agree. If every person that came into my practice was preventative care, I would love that. And it's not because I don't want to help people if they're sick, but I want people to be healthy and to realize the way to stay healthy. So I agree. I would absolutely love.
Yeah.
Single person in my office was a preventative care.
You know what else it also says? I think it's also saying that we've developed a community of people who understand where health comes from and where healing comes from.
Yes.
Right. To be preventative means that you know how the body heals and where health comes from.
Right. Absolutely.
Now you get this entire community of people who are, I know in our area they closed, but we used to have a grocery store around the corner called Native Son, and it was around the corner from the office. And when we went to lunch there, we'd see half of our patients from the day at Native Son. And I was like, yes.
Yes, you've done a good job.
Absolutely.
Yeah, absolutely. That's the reward. That's absolutely so rewarding.
Yeah.
To know that people are on board with preventative healthcare and what that means, how to stay healthy.
Right. Which
communities grow. Tell one person who tells another person who tells another person.
That's right. And now we're all living in the same reality, right?
Yeah. Mm-hmm.
So that hence is why we're also doing these interview style, conversations, is because the best way to really educate is through having some time. And if we spent, a half hour with every patient in just education and talking, we would not be able to see very many people at all. And, I think that what's important is that, you know, people are going to go on Google and do research because, you know, a lot of times Dr. Google comes into the office with the patient and, you know, there's just way too much information. So this way we can at least say, hey, this is what's going on when this happens. This is what's valuable. This is how we're working. This is why we're doing this. This is why this is important. So I'm really hoping that people find lots of value in us doing this conversational kind of talking where we can really share it with our patients.
Yeah, I agree that, you know, and we can reach many more people doing it this way than, even if it were feasible to do one person at a time, you know?
Absolutely. And even regardless of whether there are patients or not, anybody.
Oh, absolutely.
Yeah. So, you know, definitely comment below on these. Tell us what you want us to talk about. Tell us some things that you want to hear, or whether we, you know, even if you like what you hear, let us know that as well. Some people definitely are like, oh, I loved the way Dr. Rhodes phrased that. That really hit home for me, you know? So that really helps us too, if we know what you want to hear about.
Yes, absolutely. Because we're here for you, not for ourselves.
Very, very true. Very true.
Yeah.
All right. Well, excellent. Is there anything that we missed, you think, in that whole concept?
I think we did a pretty good job, and you know, yeah.
Covering that. Yeah, I think so too. I think I think that analogy and peeling the onion and the tip of the iceberg and everything that is below it, is that visual, I think is really helpful for knowing what it is as a holistic practitioner, what we're looking at. We see your tip, but we want to know what's underneath it.
Right. Yes.
All right. Excellent. Well, thank you.
Thank
Appreciate
you.
it.
Yes. Thank you.